Ron.
Good evening. The Georgetown School Committee meeting of Thursday, June 23rd, 2011 is called to order. Up first is the consent agenda, which includes the regular session minutes of June 9th, 2011, the governance minutes of June 9th, 11th, the governance minutes of June 13th, 2011, and the acceptance of warrants 52 P11, 54 P11, 56 P11, 51 V11, and 53 V11. Is there anything, as well as some communications thank you letters. Is there anything the committee wishes to remove from the consent agenda?
Nope.
Okay, therefore then, Chair will entertain a motion to approve the consent agenda as presented.
So moved. Second.
We have a motion, a second, any more discussion? There being none, all those in favor?
Aye.
Aye.
Okay, we don't have a student rep till next year. Moving on to audiences, is there anyone from the public that wishes to speak on the non-agenda or agenda item? Okay, moving on. We have Pam Lundquist in the Wellness Committee and
Yeah.
Diane Halapowski.
Yeah,
Come on
so
down.
come
Hello
on
there.
up, ladies. In your yellow notes, orange notes. Oops,
Whoa.
Hello.
Almost, sorry.
that I was
My
not
fault.
able to read. Thank you, Kristen. We're going to use you in a minute here. As I note for the publics, the District Wellness Committee has been an ongoing committee, and we've been fortunate enough in the past to have a health grant where the nurse leader was able to convene
your
that
note on that.
committee and has done some very nice work at it's a body of folks that have expertise at the classroom level, parents that are very interested. Diane's on it, obviously, to deal with the nutrition and wellness components of the plan. And there was, and in your packet, you'll have noticed there's the current wellness policy. A lot of the work this year has been working on that wellness policy, updating it, and making some recommendations for action planning, which we're going to hear a little bit more specifically about from Pam. In your notes, you'll also notice that there were some we conducted a food service survey, which we're going to talk about. I know Diane has put in your packet a bit of a summary from her perspective on some of the things that we agreed that she would focus on. We got some good information from the survey, some information that we're going to do some things with, and then we've got some continuing needs for more information, which we'll be seeking as well. So I want to thank Pam for coming on behalf of the Wellness Committee. Pam is the secretary to the committee. She keeps us all on our toes, makes sure that the minutes are all in order, follows up, with all of the important work of the committee. And Diane, thank you for coming and all the work that you've done working with the committee and coming up with recommendations. So without further ado, I think you want to start with the slideshow. Is that?
Yes, certainly. Thank you very much, School Committee, for hearing us and for taking this proposed health and wellness policy update under advisement. It has not been updated for 3 years, and so I'll give you a little bit of information about the update in this slideshow. It's been collectively assembled by everybody on the Health and Wellness Advisory Committee. We've been meeting monthly to discuss this, and we've gone through several drafts. The one that we have for your consideration is draft number 7. So some people may wonder what and who the Georgetown Health and Wellness Advisory Committee is. And it works in an advisory capacity to advise the school district and the superintendent on health and wellness, nutrition, and physical activity policies. It allows for collaboration of parents from the community with school administrators together to talk about the issues that they are important to them. Let's see. So it includes our health professionals, our nurses, teachers, and of course Diane Halapowski, our food service director. And we have a roster of active members who usually come to most meetings, as well as advisory members, such as all of the principals. If we were discussing something that was relevant to a particular school, then we asked that person be there at that meeting. But some people find it a little cumbersome. It is a monthly meeting, and that's a lot. There are a lot of meetings that people have to make it to. So here are our currently active members. Committee leader is Carol Jacobs, and you can see the other names there.
And it would be true to say that we would be interested in other people joining if they are interested. So
we are openly encouraging and inviting, parents anybody, you know, with a
Health,
child.
health professionals in
health
the community
professionals
that
in
would
the
like to get
community.
involved.
Yes, and in fact, we have just been able to get Chef Mark Twomey, who is a Georgetown parent and an executive chef by profession, to join our committee, and hopefully he'll be able to give us some very good consultation as work as a consultant. What is a health and wellness policy? It's a policy that promotes it's there to ensure the overall health and wellness for all students as well as employees. There is a component of it for employee health and wellness. And we achieve our goal by providing school environments that promote and protect children's health, well-being, safety, and ability to learn. We focus on healthy eating, physical activity, the health services, and comprehensive health and wellness education curriculums, that's pre-K through 12 toward this end. And both this policy and the committee are required by the 2004 Child Nutrition and WIC Reauthorization Act. So we have the current policy that is in place now and the one that we're proposing. And they both, of course, have a lot in common since they're the same kind of policy. They both follow they both state a district-wide health and wellness policy followed by an action plan. So the policy actually consists of one page of policy and several more of an action plan that correlates to the policy. They outline the goals and parameters of the food service program, the physical activity requirements, health education, staff wellness, and define the responsibilities of the Health and Wellness Advisory Committee. So when we say it outlines the goals and parameters, we're talking about the USDA nutrition guidelines. We're not describing the program per se. I mean, and it's not a brochure of the food service program. It describes the basic parameters that we want to be sure to stick with and include. Both of these models follow federally recommended models. Both of the policies follow federally recommended models, although they are different models. The current policy was approved in 2008 by the school committee. It was adapted by the National Alliance for Nutrition and Activity. It addresses these elements here that you see: the mission of the Health and Wellness Committee, the goals and nutritional parameters of the food service program, the goals and physical activity parameters of the physical education program, and recess, nutrition education, and staff wellness. It basically focuses on physical activity and food are the two areas of concern that it really talks about. So our new policy that the committee has come up with follows the CDC's Healthy Youth Program, which has 8 different components in it. It's called a Coordinated School Health Framework, and it basically it describes more of the programs and services that we already have in place, such as, we have the Great Body Shop in kindergarten and first grade, and we have the Responsive Classroom, which talks about social emotional wellness. At the Pembroke School, we have wellness curriculum. We have a lot of, we have health and wellness educational curriculum going through the schools. We also have like a social emotional program. So the policy that follows the 8 different components, it's just more broad-based. It addresses more factors that we already have in the schools. So individually, each of these components can contribute to the student's health and well-being. Right. And so when they're all together, then they support health-enhancing behaviors, student health, and learning. Okay. So the new policy draft, it updates the recess and physical education guidelines. It updates with the U.S. government just came out with the 2010 U.S. dietary guidelines for Americans. So those parameters, and then it adds the elements of, as I said before, school counseling, psychological and social services as components of the policy. So why do we want to update the wellness policy now? We want to address the need for a broader spectrum of wellness programs and strategies that support the district's recognition of the educational value of social emotional wellness, bullying prevention, and whole child learning. We want to update the nutritional standards and goals as the federal government is updating theirs. We want to update ours. We want to address, there is a new understanding, I think, in the world of education of the need for physical activity and how that works hand in hand with children's learning and their ability to focus in a classroom, and how important that is. And the same thing could be said for the wellness programs and services that the school has available for its students. And it's a continual improvement of this policy to just keep the policy updated with current trends in education and with our priorities as the community and the school administration together are coming to see them. So, and lastly, how will the school community, parents, and students access the policy? To my knowledge, this policy has been relatively difficult for people to find. I don't believe that it's in a handbook. And so we would recommend, if you have any other thoughts, I mean, that's fine. I just thought if it could be on the school district website and easily accessible for everybody, and then when people ask, where is the wellness policy? What is that? You can just click on the website and there it is.
The old policy was on the website,
It was.
the district website.
But maybe it needs to be in a more prominent place,
Yeah,
a little
it's
easier to
hard to
find. I
easier
think
to
that's what
access
Pam was
because not too many
speaking
people
about.
could find it. Yeah.
And
Yeah.
to be honest, it was.
It should be
was.
very easy to
I'm
find.
not sure it's still there.
Yeah, and we've been talking about having a website off of our website for Diane's office.
Yes.
And if we could do that, then this would certainly be a good place to house it. Yeah.
So if you have any questions or any discussion?
So in your packet is the draft policy, as well as the current policy. It's okay. And I should mention Pam's son helped her design the website. I always like to focus when students use technology.
He did, yes.
Like a whiz, right?
He's teaching me how to use.
He's teaching her how to use it.
PowerPoint, so.
So, Krista, maybe the lights, I think we're okay now. Thank you.
So this isn't the policy
So,
as,
oh,
as
that'll
we
help.
would vote on it.
Well,
This is a lot of
Yeah, you probably-
procedural things.
well, let's just
Well-
take a look together at it.
I mean, it's
The
governance-
first
governance we have to go
page
through
is the
first anyway.
policy. Just the policy is just one page. Okay, so the action plan is what follows. Is
Right.
what
So
gives it
let's
such
just take
length
a look at that
and volume.
for a minute. Right, so, just to follow what you're saying, Pam, so you're saying page 1
Page one is
One.
the policy.
Down to action plan.
down to action plan, got it.
We need to talk to MASC and see if they have some kind of a template already in place. Or have we done that?
Yeah, we've done that. When the law required that we have a wellness policy, I think you pointed out the date that it was adopted here. Georgetown was actually a little behind the
It was
the
actually
timeline.
mandated by the federal government in
Yeah.
2006.
Yeah, so we were a little behind. That was something that I noticed when I came here and we started talking about it and getting it in place. So at that time, there was a recommended template which included these elements that Pam is talking about. However, it didn't